Hi everyone, and welcome to St George's University of London webinar on healthcare courses and careers. My name is Jacob Bram, and I'm the Student Recruitment Manager here at the university. And we are really thrilled to have so many of you with us today, especially on a sunny afternoon and one of the first sunny afternoons of the year. So we really appreciate you coming along, giving up your time. And we really do hope that this webinar helps you making some of your choices moving forward. So joining me today, we have my co-host Jenny, who's going to be in the background answering all your questions. And we've also got two student ambassadors, Garrett and Savika, who are going to be joining us throughout the webinar. And hopefully they should be on your screens now, giving you a big wave to say hello. So we really do encourage you to ask questions using the chat function on your screen throughout the webinar, and we'll do our best to answer these as we go. If we do have time at the end of the webinar, we'll also put some of your questions to our ambassadors. And if we run out of time, we'll give you the answers via email within the next couple of days. So either way, you should get your question answered. So as we go through the webinar today, unfortunately for you, there is a lot of me talking about the different healthcare courses and the careers. But wherever possible, I will try to bring Savika and Garrett onto your screens to hear from them and what their experience is really like about studying at George's. And it'd be great to hear from you guys as well as we go. So do get your questions in the box, in the chat box, and also participate in any polls or questions we ask you. Great, so we will kick things off. So first of all today, I'm going to give you a quick introduction to St George's and tell you a little bit more about who we are, what we offer, and where we're located. We'll then start to explore the healthcare programs that we offer at St George's, and we'll discuss the type of work you may undertake within those professions. We'll also look at the workplaces you may encounter and the typical teaching environments if studying on those courses. We'll then go into the application and interview process, looking at personal statements, how our interviews work, and other elements of the non-academic entry criteria that you'll need to consider. And then, as I say, finally, we'll be joined by our ambassadors to discuss their experiences studying on a healthcare course. And if we have time, we'll also ask them your questions. So here on your screens now are a few photos of St George's past and present. St George's is the only UK university that shares its campus with a hospital, that being St George's Hospital, and we're located in Tooting, southwest London. So at George's, our students are surrounded by healthcare in this environment, no matter which course they choose to study. And you may recognise the site from TV as 24 Hours in A&E is filmed at St George's Hospital. I think what's really great about George's is when you're on the site, you're walking around and you're just literally surrounded by healthcare practitioners, patients, students, and it really does feel like you're at a university, but also in a hospital, a thriving hospital that's operating. And in the bottom right-hand corner photo, you can actually see a photo of the helipad at St George's Hospital that supports the air ambulance for patients requiring critical care. And when you're in the building, you can sometimes hear the helicopter landing or taking off, which is quite a cool experience. So there are a number of different healthcare courses available that you might want to explore. However, today we're going to be focusing on the healthcare courses that we offer at St George's. We'll begin by taking each course and discussing what type of work a practitioner within this role may undertake, and that will hopefully give you a deeper understanding of the profession. We'll then explore the different types of workplace for each course, and we'll also give you a very brief flavour of teaching at St George's to give you some insight into what studying on one of those courses could look like at university. Unfortunately, we won't have time to focus on our medicine course today. However, if you would like more detail on that course, please do visit our webinars page on the St George's website, and you can watch last week's webinar, which focused on exploring medicine for more information about it. And if the healthcare course you're interested in today is not covered, you can visit the NHS Healthcare Careers website to learn more about the over 350 different types of careers available within the NHS. And if you're particularly interested in midwifery and nursing or nursing, you could visit the Kingston University website for more information on the courses that run there. Many healthcare careers now require a degree. However, some courses do provide an in-service route. So do check with your professional body of your chosen career and contact universities for further details. We won't be providing the entry requirements for the healthcare courses we'll be discussing today, as there's so many different options of qualifications. But this information can be found out on our website. And if you've got any specific or particular questions, you can email study@sgul.ac.uk, which is on your screens now, with your for you to get your questions answered. So I'd like to kick things off today by asking you all what healthcare courses you're interested in at this point. So it'd be really great if you could type your thoughts or your ideas into the question box on your screen. No one else will be able to see those apart from me, but it'll be great to see what everyone is kind of considering in the room. So we've had a couple of people comment in saying they're interested in nursing. Unfortunately, we won't be covering nursing today, but I think some of the principles still will be really beneficial to you. But you might want to check out, let's say, the Kingston University website for more information on them. We've got physiotherapy, a couple of people, which is great. We'll definitely go into cover some of the physiotherapy stuff today. A few people put a variety of courses on there, which is really great. And hopefully using the webinar today, you might get a little bit more information about that, and that might help you along that decision process. Someone's saying that they're not really too sure, but it'd be great to care for people to come out of surgery. So we'll cover some of that caring in there today. And I say you might get a bit more information around courses you're interested in, or even if it's not any of the courses that we talk about today, you can at least start ticking those off your list and look at others. It's really great to see a variety of stuff coming in here, really. Paramedic science, medicine, like I say, some of the stuff may be beneficial to you, but again, pop onto our website and watch the medicine webinar that we ran last week. You'll definitely benefit from that. Brilliant, really great to see such a wide variety. So hopefully, I say you'll all be able to take something away from today, even if your course that you're primarily interested in isn't covered. A lot of the skills and information you take will be really beneficial to you. Thank you so much for participating. So we're going to start off with our first course, and I'm sure many of you will be very familiar with the first course, as you've seen ambulances whizzing past you in the street. But have you ever really stopped to think about what these paramedics are actually doing? Well, a paramedic is what we call a first responder, and they provide emergency pre-hospital care. So they'll work as part of a team to provide immediate care to a patient in a range of situations, such as the patient's home, their place of work, side of the road, or anywhere where they fall ill or require assistance. As a paramedic, you can work in a variety of environments, including the traditional ambulance service, which we'd all imagine. But there's actually so many more job opportunities available as paramedic, and people can work in GP practices, in hospital wards, in theatres and A&E, and even in the helicopter emergency service, as we talked about at the start of the webinar, and with the helipad at George's. Most paramedics are employed by the NHS, but some also do work in the private sector. Now, this really is the type of job that has so much variety in it, and you're never really going to find yourself sitting behind a desk. You'll need to be able to work independently and be able to take charge of a situation, to problem solve and communicate effectively with a wide range of people. To give you a flavour of what the teaching could be like at this course, we'll briefly look at studying it at George's. So at George's, 50% of the course is spent learning in the workplace and the other half in academic study. Students spend time working with the London Ambulance Service and multiple other placements, including A&E, hospital wards, intensive care, and other community-based placements. And that's great to give you a real flavour of all those different types of environment that you might choose actually to go on and work on in the future. So I think, as you'd imagine, teaching is very practical, and it often occurs in state-of-the-art paramedic simulation centres. in the university and in our reconstructed home environments. So where a paramedic will get the patient safely to the hospital, a clinical team will then take over. And one member of this team may be the diagnostic radiographer. So a diagnostic radiographer is trained to use a wide range of sophisticated equipment, such as an X-ray, an ultrasound, a CT scan, and an MRI machines. And I'm sure you're familiar with some of those and may have even been in some of those or used some of those before. And they'll use those machines to produce high quality images of the body, which assist them to diagnose and treat a range of conditions. So diagnostic radiographers will work with a wider medical team to provide a tailored treatment plan for the individual patient. So the majority of a diagnostic radiographer's work is within the NHS. However, some diagnostic radiographers do choose to work in research or in teaching. If you're excited by a job where you use diagnostic tools to create images of the human body, which will then help you to treat a patient, if you like problem solving and enjoy working as part of a team, then this could be the right career for you. So if you chose to study this course at St George's, you'd be spending 50% of your course time on placement within the NHS Trust as a student radiographer. Teaching time is also spent in high quality simulation facilities, and you can see some of the pictures on screen of our students in those facilities. And these allow our students to practice while under the support and supervision of teachers who are themselves experienced radiographers before they go into placement. At George's, we pay particular attention to developing your practical skills. So you'll not just spend time practicing how to use the equipment we've talked about, but you also build your confidence when perhaps speaking to a patient who could be in some pain because they're required to stay in a position for a scan that might not be comfortable for them. And we help train you in how to deal with that situation and make that patient feel as comfortable as possible. So we've heard a little bit about diagnostic radiography, but what's therapeutic radiography? Well, therapeutic radiographers manage and treat people living with cancer. Perhaps you might have heard of oncology, and this is the study of cancer. So the field of oncology has three major areas: medical, surgical, and radiation. And therapeutic radiographers treat cancer patients using the radiation. So a therapeutic radiographer plays a vital role in the treatment of cancer using radiation. They'll work as part of a team using their scientific and technical expertise, as well as their interpersonal skills to plan and deliver radiotherapy treatment. They'll also help patients manage side effects from treatment in a compassionate clinical environment. And if you're sat wondering why our students are wearing 3D glasses on screen, well, they're viewing a linear accelerator image within our in-house simulation center. And this really does enable our students to practice and learn clinical techniques in a safe virtual environment. So the majority of therapeutic radiographers work within the NHS again, but some do choose to work in research or teaching. And I think as a therapeutic radiographer, you really do have the opportunity to spend a lot of time with patients, and that's what's really great about this role, as they progress through their treatment plans. Therapeutic radiographers tend to spend a lot longer time with a patient than perhaps a diagnostic radiographer, the last course we just talked about. So this is a job where you really need to have excellent interpersonal skills, and you need to support the patient and perhaps their family through the treatment process. And you'll also need excellent problem solving skills as you work with a team to diagnose and then deliver the best treatment plan possible. Therapeutic radiographer students at George's will have the opportunity to practice scenarios using our in-house simulation center. And this allows them to practice in a safe environment and under the supervision of a qualified radiographer. Half of their study time is spent on clinical placement in hospitals, interacting with patients. And patient care really is a theme that runs throughout our course, and your clinical placement starts as early as the end of the first term of studying. So, our patient has now been seen by a diagnostic radiographer and is on their way to recovering. And as part of this recovery process, a patient may be seen by a physiotherapist. Now, physiotherapist uses manual therapy as part of the rehabilitation process. And that's for patients who have sustained an injury or are dealing with illness or a disability. Physiotherapy encompasses a wide range of specialities. And though you might be familiar with this musculoskeletal application in sport and exercise, physiotherapy actually has its roots in cardiorespiratory, neurology, pediatrics, geriatrics, acute medicine, and many more. So there's a lot of opportunity here. Physiotherapists can work in a range of different locations, and that could include the NHS in an intensive care or stroke unit, a health centre, sports clinics, clubs and gyms, and even in private practice. Physiotherapists really do work with a wide range of patients, from babies all the way to the elderly, and it's not just for people who are interested in sports, which is often believed. As a physiotherapist, you can look to specialise in an area of physical therapy that really is of interest to you. So you might enjoy a career in physiotherapy if you're interested in anatomy and physiology, on therapeutic exercise, in health promotion, or you might have a real passion to run your own clinic. So our students carry out their learning in the state-of-the-art simulation centre, which is, a state-of-the-art simulation centre, dedicated physio labs, a pathology museum, anatomy and dissection rooms. And all of these environments enable them to learn clinical skills and practice their techniques in a safe environment. As you'd imagine, again, learning is very much hands-on in this course, and it gives students the opportunity to develop their communication skills. So that can be in the simulated environment, such as our physio lab, and this is stocked with hospital beds, simulated stairs, and other equipment used in physiotherapy practice. Or it could be while spending 30 weeks on practice placement, treating patients under supervision, both in hospital and in the community setting. So our students tell us they really like the variety and the volume of placement opportunities most about this course. And these are undertaken in a variety of healthcare and social settings and environments, including the acute NHS hospital trusts, community-based services, charitable organisations, elite sport, and private practice. So at this point, I'm actually going to invite Garrett onto our screens, who is a current third-year student on the physiotherapy course. And Garrett, it'd be really great if you could give us a quick insight into what it is that you really enjoy about studying on the physiotherapy course.
Cool, thanks a lot, Jacob. Hi, everybody. I hope you're doing well and everyone's staying safe. So a key aspect to St. George's and the way that they teach physiotherapy is the duality of both the academic side and the practical side of things. At George's, it's very much so you learn a particular topic or you learn a particular concept, and it's followed up by a practical session where you integrate and you reinforce what you have learned in theory to what you're actually going to practice in real life. As Jacob has previously mentioned, we have state-of-the-art dissection rooms and anatomy labs, and this is a key piece of a key tool which I feel that has really benefited me over the past 2 years. Why do I mention that? I think physiotherapists have this really, I would say, innate and cool superpower of X-ray vision. What I mean by that is we know anatomy to the point where we're not even needed to open you up like those, say, surgeons or doctors, and we're able to say or even tell or potentially what is wrong with you just by looking and feeling. And I think that's a pretty cool superpower to have. And in that respect, physiotherapy is unlike any healthcare profession that I have experienced thus far. That's a quick whistle-stop tour, but I hope you have a sort of a better understanding of what the course would entail. Thank you.
Thanks, Garrett. And if you guys want to become a superhero just like Garrett, you can pop onto the website and find out a bit more information about that course. Thanks so much. So we're now going to move on to our next course. And if you think our patient is receiving treatment by a physiotherapist, they're now on their way to recovery, but there appears to be a permanent injury. So at that point, the patient may be seen by an occupational therapist. So an occupational therapist helps people to improve their ability to perform everyday tasks. So occupational therapists can support people after a life-changing accident with mental health issues and support on coming to terms with a disability that could be caused by a major trauma. So this is a career where you really can be quite creative, and you'll need a positive outlook and patience, as you'll be helping support patients to begin or to regain their independence or as much formal function as possible, which can obviously take some time. Occupational therapists work within the NHS, and that can be in a rehabilitation unit, but this career does offer much more broader opportunities. That could include working in social care, in housing, education, employment services, voluntary organisations, and even in private practice. So if you're excited by a job where you have the opportunity to have a real positive impact on the life of a patient, where you get to spend a lot of time with patients and really help them to make the most of their lives, then this might be the career for you. So studying occupational therapy at St George's, you'll spend around 1,000 hours on placement in and around London in a range of different settings. And that helps to broaden your experience. And that is what our students really do tell us they like most about the course. As well as being taught by occupational therapists, where possible, we like to invite service users and patients to talk to you directly about their own experiences. So for example, that could be about their lived experience of occupational therapy and the importance of participating in their occupations. Our students also have access to our dedicated Art of Living suite with a simulated kitchen and bathroom, which enables students to learn and practice skills within a safe environment. And our final course we're going to discuss today is Healthcare Science. And this perhaps is a course you might not be quite as familiar with. So the Healthcare Science course trains students to become physiologists who specialize in cardiac or sleep and respiratory conditions. So cardiac being heart, respiratory being lung, throat and nose. If you did choose to study this course at St George's, you'd receive training and placement in both cardiac and respiratory specialities in your first year, before you then choose which areas you'd like to specialise in. So you really do get the option, you get to experience both before you make the choice. Healthcare science really is one of the fastest moving areas of the NHS. So as a cardiac physiologist, you will deal primarily with the diagnosis and assessment of heart disease. You'll set up equipment, carry out procedures, and record and analyse the results. Tests that you will carry out could include ECGs, an angiogram, or measuring blood pressure. Whereas a sleep and respiratory physiologist will assess sleep disorders, treat patients with lung disease, deliver ventilation for patients on wards or at home, and assess all aspects of lung function. And those are just a few of the duties a cardiac physiologist and or sleep and respiratory physiologist could perform. So you'll work as part of a multidisciplinary team if you go into this sector, and you'll work within the NHS or hospitals around the world in a cardiology or respiratory and sleep department, an outpatient clinic, in chest units, sleep centres and wards, or operating theatres, depending on which route you choose to specialise in. So studying on a healthcare science course will require a large amount of patient contact, and students at St George's will experience 50 weeks spent on placement doing clinical training, choosing from a wide range of hospitals and NHS trusts. The variety, volume, and quality of clinical placement opportunities is what our students tell us they like the most about our course. The often small cohort size on our healthcare science course means that individualised academic support is available, and students on this course often mix with many different healthcare students and professionals who they then go on to work with. So I'm now going to invite Savika in to speak to us, who's a second year healthcare science student, and hopefully she's going to tell us a little bit about what she enjoys most about studying on this course.
I think, Jacob, you covered most of the things like in the academic aspect of it, so left me with nothing to say. But from a student perspective, like Jacob was saying, it's a very small cohort, so you get a lot of academic support. And if you email one of your module leaders, they will likely to reply you within a day. Another thing I really like about this course is the placement. You get hands-on experience from the very start. So I started placement in year 1, which was sadly cut short because of COVID. But just not this course, but St. George's itself, it's more like a hands-on learning. So it's like a learning by doing attitude, which I really love. You get that hands-on experience from the start in your career field. And in terms of healthcare science, after you graduate, whether you choose lung function and sleep, or whether you choose cardiac, you come out as like a pro physiotherapist. You come out as a pro technician, whether you're specializing in resp or cardiac.
Thanks so much, Savika. That's really great to hear. So we've come to the end of the courses right now. And as I said, we won't go into the entry requirements for these courses, but if you are interested and you want some more information, do pop onto our website and you can see all our entry requirements and all the information about that a bit more detail about the course in there as well. So we're now going to move on to look at the application and interview process. So we're going to briefly cover the personal statement, work experience, and the interview. So before making an application, we recommend that you do properly research the courses that you're interested in. So attending events like today is brilliant for that, and hopefully will give you a little bit more understanding. You can also look at university websites, perhaps call up and speak to their inquiries team, and that can help with specific questions that you might have. You can attend virtual open days and, as I said, other webinars just like this one. And you can even speak to students online. Somewhere like the Student Room or UniBuddy is great for this. And if you pop onto our website, you can speak directly to some of our students studying via UniBuddy. Course providers should also advise which professional body or bodies you can join when you graduate from that course. So look at those bodies now and make sure that all of your course choices will lead to registration. And it really is, the more research you can do is the better, and that will give you the most information to make the correct decision for you. So when you are ready to apply, you'll need to pop onto the UCAS website for most undergraduate websites. You'll register on there and make your application through their online portal. Really, really important is to know the application deadline. For most of courses and for the courses we've discussed today, that would usually be the 15th of January. However, it's really important to check because each year that can change with obviously things like COVID. This year, it's had a big effect. So make sure you know specifically for your course and the year of entry you're considering. You also need to know the institution code and the course code at this point, and you can find that on the UCAS website and or the university websites that you're looking to apply for. It's also really important to check that all the entry requirements for the courses you're interested in. So things like GCSE grades are really important, and make sure that you hit all the requirements so you're not wasting an application on somewhere you don't have a chance of getting into. Check if work experience is required, which often is for a lot of our courses. And if you are interested in work experience, we do have a webinar on work experience for healthcare courses on the 8th of June, which might be useful to you, and we'll send a link after this event around to you. You'll also need to provide an academic reference within your application, but your school should be able to help you with that, so speak to them. Okay, so as part of the UCAS application, you'll be asked to complete a personal statement. So what actually is a personal statement and how do you write one? I'm sure I've heard lots about it, but don't really know what it is. So a personal statement is your opportunity to demonstrate to the university your passion. So why are you interested in this course and your passion for that career? This is the only time we're going to hear from you directly before the interview. So really show us why you want to study at the university and why you're so passionate about that subject area. It also allows you to demonstrate your understanding of the profession. So if you were applying for diagnostic radiography, you might want to talk about X-ray machines and CT scanners, or a physiotherapy course where you could talk about manual therapy and exercise techniques. But it's really important not just to talk about those things, but really try to link your work experience to them so you're showing understanding and insight. Again, we'll talk more about work experience and making that connection in our work experience webinar for healthcare courses on the 8th of June. You also need to tell us why you are the right candidate. So the personal statement really should show why you are the perfect candidate for the course. So talk about your strengths and really try and sell yourself. And that can be hard when you're talking about yourself, but it's really important to try and tell us all the great things about you. And remember to use your own words when writing the personal statement, and don't be tempted to copy your friends or peers. We really want to hear from you, and they do use plagiarism software to check that it hasn't been copied from elsewhere. Something else that you might want to consider when writing your personal statement is what skills are important for someone studying on my course. So to try and help you with this, I'm going to invite Garrett and Savika back onto the screen, and I'd like you guys to maybe discuss what skills you think are important for a healthcare practitioner applying for any course. Garrett, perhaps you could kick us off.
Cool, will do. So essentials of being a healthcare professional, well, that's a wide range, but at the end of the day, I think for me, it comes down to the empathy and the care for the patient. Regardless whether you are studying medicine, healthcare science like Savika is, me as a physiotherapist, patients always come first, and that should be our main priority. And at Georges, they really inculcate this whole idea of the patient-centered care, or what we call the biopsychosocial model of health, where we're really tailoring treatments based on what patients' goals are in the future to try and get them back into both society and their daily life. It was really interesting. At the start of my first year, a staff member told me that the beauty about studying at St. George's, if you do choose to come here in the future, is that you're 50 meters away from a mother, father, brother, sister, or any family member who requires your help. And if that's not a good enough motivation to study hard and be good at your profession, then it's quite difficult to, I would say, progress in this field that you would like to be in. So empathy and looking out for the patient would be the main motivation and quality that I would personally look for in a healthcare professional. Because at the end of the day, knowledge can always be taught if one wants to know and learn. But the inherent drive and the inherent want to help people and heal is something which separates this profession from others. So Nika, how about you?
Right, Garrett, you put it out really perfectly. I mean, adding to the points you just said, in terms of in a healthcare course, I feel like you need to have good communication skills and good empathetic skills. So not just the talking, but being a good listener and using your body language to communicate with patients as well. I remember on placement, I had to communicate with the patient in my home language and not English because they weren't able to speak in English. So making the patient feel like you're able to help them and make them there in comfort as well. It's the ability to also be calm, but also prompt in situations or difficult situations. Also, these skills are not static, they're very dynamic. When you come to St. George's, you learn these skills in the course. But in terms of personal statement, you just need to show, I think, well, in my personal statement, I showed like a variety of communication skills that I learned from my placement, but not only like talking wise, but also being a good listener and through your body language.
Amazing, thanks so much, guys. And we'll come back to you very shortly on the next slide to talk about the interview. So we are now looking at the interview stage. So at St. George's, we use what are called MMIs, or multiple mini interviews, to test our candidates. So all of the courses we have looked at today require an interview on MMI. And these are a series of stations where you're asked a question in each station before you move to the next one. So each questions from each stations are marked separately and independently, and you'll receive an overall mark for the interview. And this really helps us to test your awareness of key competencies, which we'll talk about next. And I think Garrett and Savika started actually touching on some of those already. And other universities may use a panel interview or a group interview to interview you. So as I'm sure you can imagine, last year, lots of universities ran virtual interviews because of the pandemic. And these were either run by either recording a video on your own, which is what we did for St. George's, or perhaps a panel interview over Zoom. We haven't decided what we'll be doing for 2022 entry yet, but it's worth being aware that you might be required to interview remotely and starting to think how you might want to best prepare for this, maybe practicing over Skype with some friends or family. So now I'm going to invite Garrett and Tamika back onto our screens again. And it'd be great if you guys could talk about your experiences of interviewing.
So for me, it was a little different. I must have a disclaimer to for everybody that I am an international student, and as such, I had my interview online, very much like this one over the past year. However, mine was a little different, where I was in a separate room over Skype, and we had a panelist and the relevant questions, as well as personnel or even actors, because there are actors that come in for certain questions in the multi-minute interview. The key for me, the key concepts in multi-minute interviews is to be yourself. The questions are designed to tease out and to really force you to consider and think about what is your motivation to study in healthcare, regardless, again, of the course that you want to study in. Just to share with a bit of my experience, I was terrified. I was really nervous, even though I had prepared with friends and family. I would say nothing really prepares you for that. But having said that, being in a separate room and just having the interviewer and myself, it calms you to a certain extent. The fact that it is solely just you and the panelist, and maybe one other person. And it's going to be very similar to what you guys will experience if you apply to George's, where for that certain amount of time, it's just you and the panelist, or you and the potential interviewer. And as such, take your time, read the questions. At the end of the day, it's not out there to catch you out. It's simply there to tease and to try and find out if we are, I would quote unquote, the perfect fit for each other. So, Vika, how about you?
Okay, Garrett, you need to stop stealing my answers, But yeah, I mean, adding to what Garrett said, I was very stressed. So my experience was quite different as well. So I applied through adjustment through this course on results day, and I was scared because it was only a 1 hour prep before I actually got my telephone interview. So I don't know what kind of questions they were going to ask. What I did was kind of did bullet points about potential questions, like why are you interested in this course, or why do I want to come to St. George's, and some typical physiology related questions. Like Garrett said, they are not there to catch you out. They want to know what you're good at, what kind of skills you bring to the course. So just be honest and say what comes to mind. And they know you're nervous, so they're not going to trip you up. Just be honest. Yeah.
Thanks so much, guys. I think it's so great for people to, listening to hear that both of you and most everyone is so nervous going into these things, but like you've come out of it the other side and you've really, really progressed really well. So thank you so much for sharing your experiences. We're now going to ask the audience a question. So hopefully, shortly you'll be able to see a poll pop up on your screen. And I'm going to ask you which of these you think is a key competency. So we've got 3 choices for you. This should be put on your screen now, hopefully. And I want you to select which of these you think represents a key competency for healthcare professionals. So we've got a few answers coming in. Quite split at the moment between couple of the 2 of the answers, and a few evening out a little bit more now, so real variety coming in. I'm just going to leave it open for a couple more seconds just to get those final answers in. Okay, awesome. So we have a real variety of answers, and hopefully you can see them on your screen, with 30% of people going for organization and problem solving, 45% respect and dignity, and 20% professionalism. The competency we were actually looking for there is organization and problem solving. It's a key competency. So we'll now flick onto the next page, and you should be able to see some of the other competencies you might want to consider. Thanks so much for answering those. That's really good to get your engagement in the poll. So these are some more of the competencies that you might want to consider. And the competencies are a guide to skills and attributes that you should hold when considering a career in healthcare. So looking at some of these in a bit of detail, we've got communication and teamwork. And you may see why that skill is important, as you can imagine. You know, working in healthcare is really being about part of a multidisciplinary team and assisting patients. And it's so important that you're able to communicate clearly and effectively with both sets of people, you know, patients and team members. And there can often be age or cultural differences that require to adjust your communication style, just as Savika was talking about earlier. Empathy, so understanding what others are experiencing and feeling, not to be confused with sympathy. And that, again, is an essential skill to have when working in the healthcare environment. An effective learning style. So how do you manage your own learning? You know, do you like to be a visual learner and learn best through physically doing a task? Garrett was talking about how he really, I think it was Garrett or Savika, sorry, I can't remember. One of you was talking about how you really enjoy doing tasks to learn. Some of the ones you might not be so familiar with, so insight and integrity. So insight, being able to understand a situation and determine the best course of action, and integrity, having principles and values. And we'll come on to consider NHS values next. And finally, initiative and resilience. So initiative, being able to undertake action to help resolve a situation, and resilience, being able to recover quickly when something goes wrong and to learn from that experience. So I'd really recommend looking at these in a bit more detail and thinking even about examples that when you've showed these in the past, and that could be really great prep for your personal statement and your interview. So the NHS have a set of values that you should be aware of and apply in your application. There's 10 of them on the screen in the left here, but only 6 are correct. So give you a little moment to have a think about the NHS values, and then we will show you the 6 on the screen. So I think there's 10 on the left, and there should be 6 which will fill the shapes on your screen next. So hopefully you've been able to guess some of them, if not all of them. And we can see the 6 NHS values on our screen right now. So really would recommend you looking into these in more detail on the NHS website and the key competencies that we went through, as they will form part of your interview process. So as we've gone through this webinar, we've explored the healthcare courses at George's, and we've looked at what the workplace and the type of work that you might encounter if you choose to progress in one of these chosen fields. We've taken a brief look at the application interview process for studying at university, and we've discussed some of the key competencies and the NHS values. And now for the final part of the webinar, I'm going to try and keep quiet, or as quiet as I can, and I'm going to invite Garrett and Savika back onto our screens for a final time to discuss their experiences of studying on their healthcare courses and studying at healthcare university. And again, hopefully this will give you guys some great insight into what studying at a university or at St. George's could look like. So Garrett, I think I'm going to come to you first. Could you kick us off by telling us why it was you chose to study physiotherapy?
Not gonna lie, this is a question that I get asked all the time. Coming from an Asian culture, I think it's very ingrained in us that medicine is the way to go. Yeah, Savika is agreeing with me. And as such, in all honesty, I did want to apply for medicine at first, but I really looked deeper, and again, like I mentioned just now, the motivation as to why I want to help people, why I want to be in healthcare course, and at the end of the day, it's genuinely because I want to help someone. I want to care for them, and I want to make sure that I'm able to get them back to that state or that physicality before they came into the hospital. And looking at the different healthcare courses, I found that physios actually do that more than the doctors, because we are there from the start till the end. Depending on where or which area of physiotherapy you go into, like Jacob rightly said just now, we have a wide range of specialties. In fact, for every department of medicine, there is a department of physiotherapy as that accompanies it. And so we're very much a part of what in the NHS they call the MDT, or the multidisciplinary team, where physiotherapists play an integral role in the recovery and also the discharge of patients. You would, I would think, be a bit surprised to know that in certain trusts, it's actually the physio, not the doctors, that sign the discharge papers for patients. And so again, it shows you the kind of responsibility that you have as a physiotherapist. For me personally, I loved this. I loved patient contact, and seeing a patient from the minute they step into hospital to the day they leave is, I think, a very rewarding. It's really rewarding, because you see the progress and you see the recovery of a patient as a whole. And for me particularly, it allowed physio as a profession has allowed me to carry on the particular interest that I have. So after the BSc course this year, I will be going on to do my master's, but in cardiorespiratory physiotherapy. And so again, it's a wide, very wide job scope and a really wide responsibility that you're able to work in the different courses and the different areas of healthcare that you can. And I think it's honestly one of the best, or if not the best job, despite everything, because of everything.
Sounds, it's really interesting to hear. And my next question to you is going to be, or is, looking back, do you think you made the right decision? I think your final sentence has already answered that question, but like, would you make any changes if you were to do it again? No. Would you go the same course?
I will go for the same course. The 3 years here have it's been mixed, because obviously in the university life, there's going to be ups and there's going to be downs. That's the nature of university in general. But I found that the main thing that Georges taught me was how to be a clinician. It was how to treat people, and it was how to care for people. And like I said at the very start, knowledge can always be gained, knowledge can always be learned. But the skills and, again, the empathy, like one of the key competencies that you mentioned just now, that's something that has to come from within. That's something that individuals have to have, I would say, almost inherently, or like second nature. So no, I won't change it for the world.
Good to hear. Savika, same question to you really. Why did you choose to study the healthcare science course, and has it been what you expected it to be?
So from like a young age, I knew I wanted to go into healthcare course as the aspect of a patient-facing role. But again, adding to what Garrett said, all I knew at high school was like, okay, medicine is the only route I can go through. So I even went through the UKCAT BMAT phase and everything. It was a very long process. And then I realized, wait, I actually don't want to do this. And 6 years is a long-term commitment to go into medicine. You need to have the true passion for it. And it didn't feel right to go into a course that I didn't have a passion for. So I came across healthcare science from a friend, and it's a relatively new field. When I came across it, I was like, healthcare science, it sounds like an A-level course that you would do for a little certificate, but then it's like an umbrella term for various different roles, and I obviously chose the physiology side of it from St. George's. And to be honest, I'm really glad I applied for it, because even prior to applying, from my quick research I did, it came up with, like, you learn the science behind it, but also you get the hands-on experience in the field. So after 3 years, you have a good job security in the NHS. And also in terms of just healthcare in general, you have a good job, like progression. There's always things to like do, like masters, and progress further into your career. And there's also a level of flexibility. I feel like it's a really underappreciated course, and it should get more recognition.
Give it
That's why I'm here.
Representing.
Yeah. And also going back to, yes, I think I have made the right decision. I'm enjoying it very much so far. Like I said again, you learn the science and you get the hands-on experience. And I've really enjoyed my placement so far. I've met quite like a lot of interesting patients, and I've heard too many interesting stories that I shouldn't have probably heard, to be honest. Patients get really involved in their lives, but it's been really fun.
Oh, amazing. That's really good to hear. Like, it sounds like you both are so passionate and, you know, enjoying your courses, which is great. I think we've heard, like, obviously you've talked a lot about the good things, which is brilliant. I think it'd be interesting to hear, maybe Savika, if you can go first, and then Garrett, you know, what do you think are the challenges of studying on your course, and maybe challenges for studying any healthcare course?
Hands down for me, it's the time management and the workload. I from university, sorry, from A levels to university itself is a big jump. Um, I found this personally very difficult because, for example, during A levels, if you're doing biology A level, you get all your content in one book. You can just physically inhale it before going into an exam. But in terms of university, you have to collate information from different lectures and make links between each of them. And in terms of time management, I was really bad at it. I used to cram. First year, I crammed everything before my first year exams, which I do not advise doing. And I learned it the very painful way. So it was, for me, it was the workload that was very difficult. But that being said, you learn it as you go through the course. You know, it's academically vigorous, especially on a healthcare course when placements come in and you have exams to hand in and things like that. But it's something you learn as you go through the course. So I'm not going to scare anyone. It's fine. It's just towards the end I crammed, but it's fine.
I think for me, it was similar to Savika. It would be the workload with how much you have to learn. This used to be a 5-year course, so it was actually the same time as same course duration as medicine. But what they did was they essentially condensed a medicine course into 3 years. So the first 2 years is literally it's literally like lecture after lecture, anatomy session after anatomy session, and really grilling into you the key concepts, because that serves as the basis of your knowledge as a physiotherapist. Again, like I mentioned, we have this superpower of like looking at people and not even being able to and not needing to open you up. It's very, very true because of that knowledge. When I was on placement, so I was on COVID ITU during the second wave, and they couldn't use stethoscopes because of infection control. For those of you listening, on those of you attending, do you know that you can auscultate or someone without the use of stethoscopes, i.e. you can hear people's or know what people's lungs feel or hear like just by touch? And that was something which physios actually established as a further skill. That's very, very cool. I've never seen something like that, and that really impressed me. And so I think it's adapting and knowing, again, taking stock of all of the knowledge you have and then adapting it to suit a certain environment. But because of, on the flip side, because of this vast amount of knowledge, you have everything at your fingertips. You know how to treat patients, you know how to be empathetic, you know how to care for them properly. And I would say that's the reward, and that's like the motivation that you guys need to keep hanging on to get you through this course, because it is very intense. I'm not going to lie, it's very, very intense, but it is very, very rewarding in the end.
So interesting to hear, Garrett. You taught me something today. I had no idea that you could do that without the equipment.
Again, if I did not go on that placement, I would not have learned how to literally feel someone's lungs without the use of a stethoscope. Because people think that if you attribute medicine, the first piece of the first object that you see is like either the cross or the stethoscope or the syringe.
It's even in the fancy dress set.
Even in the fancy dress set, So the thing that you can actually use your hands and you can feel, that's, again, a physio's best tool is his or her hands, or their hands, his or her hands.
Amazing. Thank you so much, both of you. Just had one more question. What do you guys think our attendees or people watching today could do now to help prepare them in advance for a healthcare practitioner interview in maybe 6 months time or longer?
Savika, you want to go first? No. Yeah, you can go first.
Yeah.
I answered a lot today.
I think I already talked a bit about it, but I think prepare potential questions. There's so many resources online that you can, whatever course you want to apply to, if you type, even if it's medicine or any of our courses, if you type in potential healthcare questions, they do come up. And also practice with maybe a family member or friend, or even in front of the mirror, which I have done. So just look at how your body language is, make sure you good eye contact if it's in person, and just like be yourself. And yeah,
Amazing.
on to Garrett.
Yeah, I definitely echo that same thing of being yourself. In an interview, like I mentioned just now, they just want to see how you are in certain situations that is very closely mirrored to that of a real life clinical situation. And it's about finding the right fit. It's really showing the interviewer and the panelists your motivation to study the healthcare course that you want to study. So, again, you guys have had so many different jobs or different healthcare courses that you want to go into, and that's great. But you need to really understand or really tease out what's motivating you for that course. Is it really the patient care? Is it the eagerness to learn and for more knowledge? What is it that keeps you up at night to constantly improve yourself on a day-to-day basis? That's what they want to tease out. And that's my biggest piece of advice that I can give you guys, because once you have that figured out, everything comes in flows from there, because suddenly the knowledge or the work that's being thrown at you and all the different assignments don't seem that daunting, because at the end of the day, that I'm training to be a physiotherapist, I'm training to be a healthcare scientist, I'm training to be a radiographer, a doctor, a nurse, whatever, a pharmacist. And yeah, having that's I would say my biggest piece of advice. So yeah.
Amazing, thank you. It's been I've really enjoyed just speaking to you both today and learning more about your courses. So I hope all the audience have really enjoyed it as well, and a big thanks to both of you for joining us. We are running a little bit short on time, so we're going to move on from the Q&A and just shortly finish up. But if you do have any more questions that you'd like answered, do type them in the question box, and we will get back to you via email. I'm just now like to kind of sign off today and say, we really, really hope you have enjoyed today's webinar, exploring our healthcare courses and future careers. You will be sent a recording of this event after via email. You should get that by this time tomorrow. But if you do have further questions, you can get in touch with us at webinars@sgul.ac.uk. You can also contact study@sgul.ac.uk, as I mentioned earlier, for questions about our specific courses. And you've got all our social media tags on screen for you there. And finally, just before we end, we wanted to highlight that we're running another free webinar on the 8th of June, and that's exploring work experience for healthcare courses. So really beneficial, if you've enjoyed today's format and want a bit more information about work experience in particular, we'd love you to come along to that one. We're going to look at why universities ask for work experience, what type of work experience is useful, and even talk about how you can reflect on the experience to really make a strong university application. So you can book your place online, or we will send you a link as well, as I say, after this event. And that's everything from us today. So a big, big thank you to everyone who's come along. Huge thank you to Garrett and Savika for giving us up their time. Really enjoyed hearing from you guys today. And wish you all the best on your future university applications. Thanks so much, everyone.
Thank you.
Take care.
Bye, everyone.
Bye.